I've heard the complaints that the job doesn't do things for those people that are facing discipline. And I'll use the example of Eric and John from the Finest Unfiltered 0805 show. They did a show and they spoke about it, and they weren't happy with the job, with the response to Eric getting 8 sets of charges in 2 weeks. And why weren't they worried about his mental health when all of that got piled up on top of him? Because obviously we're going to get into the external things that interfere with people's lives and their mental health. And that's one of the things, right? Someone that's dealing with discipline. But however, discipline is also confidential. So the only time that health and wellness would find out about someone's disciplinary problem is after it's adjudicated and it comes down to the finest. So that was brought up, and that was brought up to Inspector Wakta. And I know that now that there are instances where the Department Advocate's Office is dealing with heavy disciplinary cases and do make referrals to health and wellness to reach out to make sure people are okay. And again, one of John's complaints was that during COVID, those members that were either forced to vest out, forced to retire, or terminated because they refused to get the vaccine and follow the mandate, that health and wellness didn't reach out to them. But again, the bigger picture is that they weren't aware of it because, again, that's confidential HIPAA information. Even when it became quote unquote disciplinary, like we have a member of the Finest Done family, Marlon Bethel, was terminated. 15-year detective. He's in the chat. 15-year detective refused to take the vaccine and was terminated without any due process.
Not right. Go ahead. I'm sorry. He was really terminated, right? They didn't even serve charges or anything else. They just kind of told him you're not here anymore.
And he didn't. And yeah, one day he called up and they said, you're not even in the system anymore. That's how he found out. Like he wasn't even like, so, and nobody reached out to him. Nobody reached out to John, who had to vest after 18 years because his religious and his medical accommodations were denied by EEO. But again, unless it's referred to them, and that's the point I'm trying to make, and I'm defending health and wellness because I'm aware of the process, that it's a referral base. So somebody has to step up and step forward and say something, whether it's the member themselves, another member, or a family member, in order to get the help and get that ball rolling. Do you want to speak on that a little bit?
I mean, to your point, just in terms of the member has to call, there's really two components to that. I think one is motivation. You could make a call for somebody, doesn't mean they're going to follow through or, take the next step. But the other is confidentiality, because then what you're asking to do is to have someone discuss somebody's case with somebody who's a third party. And, Finest Care is based on confidentiality. That's the foundation of the entire program. You know better than I do that if confidentiality is breached, the program's done. The word will spread and that'll be it. So, you want to really hold to that confidentiality.
Right. So, and that's the importance of it. And that's the double-edged sword of it, I think, is that what they're doing is tremendous outreach. A lot more outreach than they've done. They've expanded the programs and they're doing the outreach. But now it's on us, other members, whatever the case may be, to, look out for one another.
Many of our locations have signage. Out in Bayshore, it's the Unified Behavioral Health Center. So there's a sign that indicates behavioral health, but some of our locations give no indication. So if an officer was to be seen in person, say in the city, they would go to Manhattan Eye, Ear, and Throat Hospital, go up to the 5th floor to the Hand and Wrist Clinic, where a Finest Care clinician would bring them to a back room. No indication of behavioral health, no indication of NYPD. Like I said, some of our locations do have signage, but others don't. So that confidentiality is a big piece.
Yeah. So again, like Rob said, if anybody in the chat has any questions for Dr. Wakschal, we'll start getting to those questions for Dr. Wakschal. If you have anything specific that you want to ask, he's not just, here to talk about, finest care. We're going to talk about another program that you invented, how do you want to say it? That you started this program and you put this program together.
Yes.
And that's called Conquer.
Correct.
Right. So go ahead.
Conquer is based on, again, the foundation that sometimes asking to reach out doesn't work as well as reaching in. We're all for the the attempts to break the stigma, reach out, make the call, all the promotions to get cops to reach out. But we're focused more on reaching in, of getting back to the basic of, am I my brother's keeper? I'm responsible for the person sitting next to me in the RMP or the cubicle or whatever. And we want to move away from blaming the job, because as soon as you start to blame the job, you've removed yourself from the equation of having had any role in it. Well, it's the job that caused him or her to take their life, So we focus on what to look for, which are not stereotypical of what we've always been taught to look for. And we teach to look at the entire person, because again, suicide is incredibly multifaceted. It's genetic, it's developmental, it's anthropological. There's so many things that go into somebody taking their life. One of my pet peeves is there's of what I consider to be like a flavor of the month, psychological autopsies, where you go in and you look at that person from day one, from elementary school. You conduct dozens of interviews with people around them, and you really delve into their history, and at the end you come up with one, did they take their life, which that's why psychological autopsies were created to begin with. But two, okay, this is why. And it doesn't involve common sense, because say it shows that, okay, this officer took his life because he was having financial problems, or he found out, or she found out their spouse or partner was cheating on them. You have to step back and ask yourself, if every cop who was having financial problems, or every cop who was getting GO'd took their life, how many cops would we have? You can't break it down to a single solitary cause, because the problem is, once you do that, then that's where your efforts are focused. You say, okay, you know what? She took her life because, her boyfriend was cheating on her. All right, let's come up with a program to address that. You're going to miss the boat. It's much more multifaceted than coming up with a single reason. That's one of the problems. So Conquer, we look at the whole person, again, from genetics to life experiences, and we focus on what we call the 6 pillars of police suicide. And we go into those.
What are those 6 pillars?
Well, the first one is hopelessness. And sometimes you don't have to do a lot of research to know what something means. If you just look at a dictionary, or not a dictionary anymore, but you go online and look it up. Hopelessness is basically the belief that there's no possible outcome of success. There's no reason to expect good or success. You couple that with another pillar, which is hopelessness, which means there's nothing I can do about it, nothing I can do about this, and there's nothing anyone else can do about it. So you start to get the mindset of the person who's suicidal, that there's no way things are going to work out, and there's nothing I can do about it or anyone else can do about it. The biggest one we deal with is what's called the police officer's paradox, or emotional constriction. You think about, how do 32,000 control 8.5 million? You do it with a presence. You do it with an air of authority. You do it so that 99% of us say, thank God the cops are here. Thank God someone knows what they're doing. They're going to keep control. They're going to keep us safe. Problem is, it's very difficult to toggle that off, that air of authority. So what starts to develop is some isolation, because being a cop is not a normal job. What you guys see and hear and do in the course of a day, civilians don't see in a lifetime. if I see a DOA, they look better than me. They're dressed nice. They got nice skin color. They're laid out. They're comfortable. They got a bottle of Jack under their arms. You see a DOA, they don't look good. You know, whether it's a jumper or self-inflicted or a man under. Then what do you do with that? Do you go home and start to share everything you've done? Sometimes you can, but you really can't. So more isolation, more withdrawal. Then, you know, you go out to eat. Where are you sitting? Where's your back? Against the wall. And while this person that you're having dinner with is trying to have this important discussion with you, what are you looking at? You're scanning. You're in scan and pounce mode. Again, more being considered aloof or disconnected. You can get invited to a wedding or some event, and someone asks you, "What do you do for a living?" "I'm a New York City police officer." "Wow, what's it like to shoot somebody?" I always wondered. And I saw on TV they shot the guy 7 times midsection. Why didn't they just shoot the gun out of their hand? And your response is, "Okay, I'm not going to speak to you either." You know, so it's that distancing. So that's one of the pillars is that isolation and distancing that develops. Another one is moral injury, which we're starting to see a lot more of right now, and that's where you witness or you're involved in something that goes against your moral, ethical belief system. And you're left sitting with that. Should I have said something? Should I have done something? Oh, I did do something. Why'd I do that? So that confusion plays into it. Some of our cops by generation now that we've raised also have a very hard time sitting with discomfort. They look to get rid of discomfort very quickly. And how do we get rid of discomfort? We drink, we overshop, overspend, overeat, gamble. We engage in activities that they don't cause suicide, but some have a correlation with a really bad outcome. And the last one is something called approval being performance related. Again, we've raised a generation that's used to participation trophies. And a lot of our officers today cannot tolerate not getting approval, especially from a boss. And that sends them into a bit of a tizzy. But, you know, those are some of the pillars, but you have to think, you know, genetics. We've identified 4 specific genes that people who are suicidal have that non-suicidal people don't have. You know, there are developmental factors, environmental factors. A lot goes into it. It's never, look at depression. Depression causes suicide. That's a myth. Depression doesn't cause suicide. Right now, there are well over 20 million people diagnosed with depression. We know that by tracking prescriptions, office visits, ER visits. Over 20 million. If you add to that the number of people who are uninsured, untreated for whatever reason, that number could jump upwards of 25 million. The suicide rate in the United States tends to run between 47 and 49,000, although this past year we went above 50,000. Common sense tells you if depression causes suicide and there's 25 million depressed people, why is the suicide rate 49,000? It contributes. It definitely plays a role, but it's not causal. So, you know, all these things play a role.
You've just watched a clip from our live episode. Click the description to watch the full episode. Like, share, and subscribe for more videos just like this.